Right. All right. Good evening, good morning, good afternoon, wherever you are in the world. Thank you for joining us for another one of our Viz for Social Good sessions. Today we will have our top 5 submissions here today to present their visualizations. And so we should have a fun session. For those of you who don't know, practice these things and then they stop on you. Our client this month is Sunny Street in Australia. So I'm wearing my Australia Socceroos jersey this morning. And also my colleague and co-host Frederick is down in Australia. And one of our presenters is down in Australia. So lots of reasons for me to wear my Australia jersey. So I will give you a quick introduction. I will talk about Viz for Social Good. Unfortunately, Sonia is ill this evening and can't be with us. So I will give a quick run through of Sunny Street. Then finally, the volunteers will get a chance to show you their submissions, and I will be quiet for a while, except in between. We'll have a Q&A, so feel free to ask questions. Put questions in the chat. If you're shy and don't want to turn your microphone and ask a question, you can put a question in the chat. And hopefully Frederick can check the chat and see if we have any questions coming through there. And then, as I say, unfortunately, we'll do a follow-up session where Sonia can reveal her favorites of the favorites, I guess. So really, really narrowing down what were really her favorite of the favorites. But we have 5 really excellent vizzes for you to see this morning, this evening, this afternoon, wherever you are. So let me just give you a quick rundown of Viz for Social Good. If you did not know about Viz for Social Good already, what we try and do is to help out nonprofit and charities all throughout the world by asking them to give us their data so that we can make that data available to analytics professionals all throughout the world who volunteer their time to analyze that data and see if they can find some nuggets in there, if they can find a story to tell or an interesting piece of analysis that they can find. And so we have a lot of fun with this. Chloe started the organization back in 2016, working with Tableau and the Tableau Foundation. I started working with them in 2018. So we're a relatively new organization, but we've done quite a bit in those few years. We've helped out quite a few organizations. We've had lots of folks participating. And again, what we're trying to do is create visualizations to help tell the story that is buried in all of that data. And so our clients, our customers, will use them in their annual reports. They'll use them in social media postings. They will embed them and show them off on their websites. Maybe their boardrooms are using them when they go out and look for some of that valuable funding that the nonprofits need. They use these in lots of different manners and ways, and we're really happy that we can help out anytime we can. We are now up over 4,500 volunteers. We have done more than 30 projects. I think we're probably more than 40. If we're not, we're probably getting close. And we've done locations all over the world, all over the map. Here's just a few of the various projects that we've done over the years. And we are always looking for more. So if you're out there and you're thinking, hey, I've got a charity, I've got an organization who might benefit from what your group does, let us know and contact us. So we've presented at Tableau. That's where I got started in 2018 when I first met Chloe at the Tableau conference down in New Orleans. We've gotten some various recognition over the years from the UN, and the Information Beautiful Awards. We have a really strong board of directors all throughout the world that has now joined Chloe to help take this organization to the next level. So we've got various board of directors throughout the world, and we have several folks that are the leads for the different areas. And I believe we've got Candy on the call, we've got Aida on the call, and myself. I'm the lead for the Americas along with Candy. So if you've got an organization in North America, ping us, let us know, and we will do a follow-up on it. Just grabbed some of the screenshots and to show off some of the projects that we've done in the past, some of our favorite ones with some of our favorite visualizations. And you can see that our volunteers are very, very talented. And we really appreciate them because we couldn't do what we do without all of our volunteers. And so we get some really, really amazing work from you all. And I'm always amazed, and I will be amazed this morning as well. This is probably my favorite project out of all of them, working with the Kevin Richardson Foundation, trying to raise awareness of the dwindling lion population in Africa. And as a college professor, I always assigned this as my first Viz for Social Good to get them started, because there wasn't that much data, and try and find the story. And our volunteers are always good at doing that. Here's where I would pass off to Sonia to say a few words about Sunny Street. Sunny Street, like Viz for Social Good, is a young organization. Just started in, I believe, 2017, 2018 timeframe. In 3 short years, they've done some amazing work. They really have. And in 2019, we took this, or a group took a small amount of data they had and helped them with some data viz. And so this is kind of round 2 of, now they've been around for 3 or 4 years. They've got much more data and hopefully a lot more analysis that volunteers could do for that. And that's what you will see today from our various presenters. So I think the final tally was 56 submissions from volunteers all throughout the world. And so basically what we have is the top 10%. We've got the top 5 here today to show off their visualizations. Frederick was so kind to take the data of the submissions and create a data viz for it. I love data viz about data vizes. And so here you can see, like I said, I think we had one submission that was submitted twice. So we had 57, but I believe we're at 56. But we got quite a few of them from India, and I think quite a few of those were students. So college professors, students out there, let's try and get universities involved. Like I say, I was a college professor for 30 years. Earlier this year, I had 28 students do one of our projects, and that was a very proud moment for me. So please share the word about Viz for Social Good. Let's see if we can beat 56 submissions in our next project. But quite a few from India, the United States, Australia, no surprise there, the UK, Singapore, and so on. The majority of them tend to be Tableau, but we love to see other tools out there. So don't be afraid to use a different tool and analyze the data in it maybe a little bit different way than most of us that are using Tableau to do this. So on this project, some folks used Adobe. We had Python, and you will get to see one of our Power BI ones this evening, as it was one of the top 5, and I'm really happy to see that. Got a lot of full-time folks doing it, but we also have plenty of students, which again, as an ex-college professor, I'm glad to see. Hopefully we can keep that going. Some folks are self-employed. We've got 42% are beginners this time, and I believe quite a few of those, this was their first submission to Viz for Social Good. So we love to see those as well. Plenty of intermediates. We've got some experts, and we had some that didn't specify. And I would venture to guess they're probably experts and they just don't want to brag about themselves. So we're going to go through the 5 Vizes with our 5 volunteers. And so first up, we have Nicole to present. And Nicole is just right up the road from me. So if I will stop sharing, now Nicole can share her screen. Nicole is also at a university just up the road from me. She works at Emory University in their Office of Institutional Research and does analysis there. So let me throw it over to Nicole and let her introduce herself and walk us through her visualization. Thank you for being here, Nicole.
Sorry, Kevin, do you want to do 5 minutes? Do you want me to do timekeeping? Sorry, Nicole. Should we do 5 minutes timekeeping?
Sure. Yeah,
I can do it.
Okay.
Okay. Over to you, Nicole.
All right. Well, thank you guys. I was really excited to participate in this, and so excited to show off the amazing work that Sunny Street is doing. And I'm on 2 screens, and I can't quite figure out how to get it over because it's too early. So I'm not going to look at the camera. Sorry.
Yeah, you're good. We've got your viz.
Yes. So when I started looking through the data, I started with the code book, and I loved that there was some qualitative data in there. And so I wanted to start with like reading through their comments and reading through the website, because I felt like the quantitative data was what they were doing, but the qualitative was really who they are. And I wanted to make sure in my viz, I was bringing out who they were as people in an organization and not just what they were doing. So as I read through that in their website, I wanted to start off with some background information on the people who live in poverty and who are homeless in Australia, because in their About Me, that really was kind of why they got started. Throughout the viz, I put in quotes to kind of really bring home that impact of what they were doing and just what a difference they were making in people's lives. It was very interesting for me to see where they were serving. I've never been to Australia, so I got to learn a little bit about Australia and the different areas. I really enjoyed that. And then this is where I felt, they were really showing off what they were doing and how much work they were doing. So in their consultations, especially, the medical and the nursing paramedic, just how many people they worked with. One of the questions that they posed when they put out the data was, how was COVID what kind of impact were they making pre-post COVID and how that changed it? And I wasn't surprised that shortly after the shutdown, they did have a spike in consultations and conversations. It looks like they were kind of ramping up pre-COVID, but then it really just hit, and it hit worldwide. Just people who needed help, especially with the mental health. There it goes. Tableau Public reloaded. So, and then just how they were able to adapt as well. My screen's going crazy. How they were able to adapt as well, and they weren't doing telehealth beforehand, but they were able to adapt very quickly when the shutdown happened and start offering telehealth as well. And then my background is in psychology. I'm a huge mental health advocate. So I loved seeing all of the mental health conversations that they had as well. And again, especially with COVID, the spike that happened after the shutdown. I know from the US perspective, just the number of people with anxiety and depression went through the roof right after that. And I'm sure it's that way worldwide. It was very interesting for me. They offer all their services at no cost, so I was interested in seeing how they got that funding. I'm going to go through because of time. Another question that they asked was about the demographics of their patients or their clients. And so they do serve a few more men than women. It is more men than women, but it's not egregious. And the fact that about 40% of their patients are homeless is just astounding, because that is such a population that doesn't usually get the attention that they need. And most of their patients are 18 to 54. I read in the notes they had a patient who was as young as 6 months old. So they definitely serve a broad range of people, but 18 to 54 is kind of in the majority. And then with the ethnicity, it was good to see the breakdown, but a lot of people didn't specify that. So that's one area where there's not a lot of conclusions to make. Through the Slack channel, Sonia brought up that they're very interested in seeing the impact, the financial impact that they're making as well. And so with some data that Patrick found, I went through and put together, if 10% of their clients didn't go to an emergency room because they went to Sunny Street, that's already $212,000 that was saved the health system in Australia. And for conversations, because they have so many more conversations, that's already 932,000. So even if just 10%, they're already making a huge impact on the health system. But Sonia was mentioning that for the people that they've surveyed for the consultations, it's close to 100% aren't going to an ER when they would have. And so that's over $2 million impact. So besides the quotes for the individuals that they're helping serve the larger community as well. And it's just amazing to see. And so I wanted to make sure that at the end, everyone who got to see all the amazing work that they're doing knew how they could volunteer as well. Since it is a very primarily driven volunteer organization, we'd love to see them be able to keep doing the work that they're doing. And that is my viz.
Well, thank you, Nicole. That's really a beautiful viz. I could see the Office of Institutional Research in your formatting and your analysis, how you went about it. I love the fact that you have this psychology background, but you also have an art background, and your artistic side of you also came out in your viz as well.
Thank you.
Hey, Kevin, can I say something?
Oh, absolutely.
Amazing. I think one of the things we want to do for Sunny Street is maybe a bit of a handover as well. And I really feel that the last chart you got with the cost saving, that's something that would be very well on, if you could save that as a PowerPoint, and because I'm sure they'll be using that for the pitches and then get some funding. So that's something we're going to communicate to you guys later on. But even the top 5, if we're going to come up with some sort of handover kind of process, and one of them could be saving your dashboard into a PowerPoint deck, because I think that'd be amazing for them to go in the street and present that to the stakeholders. And your table with the saving, I think, is really amazing. It talks. I mean, I try to do the same on my viz, but yours is much better. So well done.
I loved how you did it on yours, and I'm so glad you were able to find that information.
Yeah, that was good information. But well done again.
All right, next up we have Vivian, I believe. Vivian is a student in computer science and advanced math down in Australia. So Vivian, can you share your screen and walk us through the data viz that you created for Sunny Street?
Yeah, sure, but I'm not a computer science student. I'm just a data analyst student, so not that professional in coding. Okay, so I can start. So hi, I'm Vivian. I am a data analyst student at Duke University. And today I'm going to talk about, today my topic is Let Sun Drive Out Darkness. And I'm going to share my insight about Sunny Street. So firstly, I start with why is Sunny Street work important? So it says in some articles that more than 116,000 people were estimated to be homeless. And the rate of homeless has dropped from 50 to 45 in 2006, but returned to 50 in 2016. As for the poverty, 3.24 million in Australia live below the poverty line in 2017. And the poverty rate in Australia is actually worse than in most other wealthy countries. So definitely we should all support Sunny Street to continue its great service since there are so many people in poverty, or homeless. And now let's turn to Sunny Street's performance. So since 2017, Sunny Street has served in 15 locations and has discussions with 837 patients. Within the total 1,307 hours, it has performed 3,773 consultations and 16,561 conversations. Currently, it's operating in 9 locations in Brisbane, Sunshine Coast, and Fraser Island. And most conversations are actually performed in Sunshine Coast, represented by the size of this pink circle. If we analyze the demographic data of Sunny Street patients, we can find that 52% of them are male and 39% of them are female. So comparing to the demographic data of other SHS clients, usually female would account for 60%, but the average homeless rate among the patients. So I would wondering if female is underrepresented in Sunny Street patients. Also, the average homeless rate is 40% among the patients. Among all years, the age of patients actually range from 0 to 89. So that's definitely a large range. And the median age would fall into 40 to 44. But this year in 2021, we can see that the range has actually narrowed down to 15 to 74. And the median has increased to 45 to 49. If we look at the average homeless rate by different age, we can see that the highest homeless rate appear in our teenage patients, where 51% of them are homeless. And all the average homeless rates among patients range from 10 years old to 64 years old are all above the average. And finally, I look at the percentage of homeless by gender, and I see that I find that male has on average has a higher homeless rate, which is 44%. So finally, how is Sunny Street performing over time? We can see that the number of consultations performed in each month shows some seasonality, higher in early winter and early summer, and lower in January and July. Peak appeared in May 2020, like Nicole said, shortly after the COVID starts. So that's pretty interesting. And the minimum appeared in January 2021, where only 147 consultations were performed. Comparing the first 4 months this year with the first 4 months in 2020, we can see that a lot more conversations were done with both patients and service provider. Slightly more conversations was about substance use and the suicide prevention. Also, a lot more conversations were performed by allied health member and also over the telephone. Last but not least, I compared the locations where Sunny Street operated with the geographic distribution of the patients. The yellow represented the client location, and the pink is the geographic distribution of clients. And we can see that it has a strong location. When Sunny Street started to open a new clinic in Fraser Coast, suddenly more patients are come from this area. So that's the end of my presentation. Thank you.
Well, thank you very much. As you can see, before you stop sharing your screen at the bottom, again, college professor and me has to point out, look at the references she has down at the bottom so we know where she got some of her data and material for her viz. I love to see that. And I love the inclusion of the maps. And also I got folks mixed up there. I forgot that you were at Duke University doing your graduate studies, and Duke is one of our largest Tableau universities. They have lots of videos and tutorials and things there. So if you like videos and learn Tableau by video, check out Duke's site. And if you can't find it, ping me and I'll point you to where Duke has lots of material. They use it all throughout their offices and plenty of their students do it as well. And again, I love to see our students doing this. The future looks bright for data viz and analytics professionals. Again, makes me proud to see this for Viz for Social Good. So if you can stop sharing your screen, Vivian, we can go.
Sorry, I suddenly can't find where I can.
Should be
Oh,
down. There you go. All right. So next up, I believe, is Johanna. And she is also another student from Australia, if I get Johanna's right. She's studying at the University of Sydney and studying analytics and marketing. So really good combination of those two skills. And again, loving the students, this project. So many are in there. Also forgot to mention when Nicole was presenting, Nicole was one of our finalists in our Atlanta Iron Viz competition that we had through the Atlanta Tableau user group. So congratulations again, Nicole, on being one of our finalists.
All right, can you see the screen?
Yes, we can see it. You've got it.
All right, cool. Okay, hi everyone. So yeah, let's just get started. So first, I start first with a brief introduction about what Sunny Street is, in case anyone doesn't know about it. And then I proceed with the problem statement. So I just use the big numbers because it really shows that there's actually a lot of people who actually needs this kind of service that Sunny Street is actually providing, like homeless people, people admitted to hospital care and mental health support, and also people who have substance use disorder in Queensland. And then this one is, it's more about asking the question, so where do Sunny Street actually operate? So in total is 20,334 interactions, and you could see that that one is the accumulative growth rate of the number of interactions over time. And initially in the early 2020 or before 2020, we can see that the rate is pretty flat. So there's not really that much growth compared to after COVID after that, which yeah, it will be shown later on in the breakdown chart later on. And yeah, we can just explore here in the different activities, how many consultations and how many conversations in per area there. Okay, so this one is the breakdown. So this one is the consultation, and this one is the number of conversations over time, the accumulative one. And again, the rate is a bit similar to the one here. And then we can see that the number of conversations, the highest is patient conversations, where the lowest is suicide prevention. And then consultation type, the highest is nursing or paramedic, and the lowest is nurse practitioner. So for this one, this is the trend. So we can see per month. And I intentionally make it in the same line, so that it's really easy to see that it's pretty much similar, the trend. So the highest has always been in May or in June, which is just shortly after COVID hits on March. Only the exception is for suicide prevention, which is in where the highest number of conversation for suicide prevention is on November 2020, which is a bit interesting why this is the highest here while the others are around June or May. Well, for consultation trend, they're all pretty different from each other, but a very starking difference is nurse practitioner. You can see that before COVID, it is actually pretty high. So the highest is 31 consultations on October 2019. But after COVID hits, it gets kind of low. So the highest here is only around 7 on July, and the others is not really as high. So again, then going to the next one is asking the question, so which day is actually the busiest for Sunny Street? So this one is the potential interaction. So it also includes the number of patients turned away here. And the interesting part is that it has always been Wednesday that has the highest number of patients turned away. And the yellow line here, it shows the total duration that it opens per day for the whole operational years. And we can see the difference here. Like on Tuesday, it's actually less compared to Wednesday. So hypothetically speaking, actually Tuesday should have higher number of patients turned away. And we can see that every year, including in 2020, where Tuesday also has higher number of conversations and consultations, even Wednesday always has the highest number of patients turned away, which is pretty interesting. So this one is the demographic of the patient. So over the time, you can see that it's a bit similar. The one that is always the highest in proportion has always been these two segments, 41 to 50, and also the 51 to 60. So this one is the overall, well, this one is the breakdown per year. And yeah, I included some pictures just to make it more relatable, so we could really imagine how the patients actually are. And then for ethnicity, even the trend is a bit similar. There has always been people from Australian descent, who is the highest proportion, followed by the indigenous descent. While this one is pretty small, not provided is pretty high though. And then for this one is the gender and homeless rate. The interesting part is homeless rate is actually the lowest in 2020. Although it's not that much different, it has always been around 40%, only except this one. While for gender, it has always been male, which is the majority. We can see over the years, it's not actually improving. Actually, in 2020, the highest proportion it's 57.78, while in 2019 it's 44.42. So this one is the sentiment, because I didn't have the information for the rating of the satisfaction from the patients. So yeah, what we only have is the feedback. So I did a feeder sentiment in Python to see how many are positive and how many are negative. And from here, we could see that the negative are actually not that much. It's just around 1 patient. And here it's 4 patients. Most are pretty much satisfied. But then again, of course, it's something that needs to be addressed then in the future. And then lastly, it's the call to action. So yeah, how you can help, and a button which can lead you to the website itself. So yeah, I guess that's pretty much it.
Again, another beautiful data visualization with some really good analysis there. Again, you can tell the student coming out and with her background and knowledge, taking that and applying it to a different data set. Really enjoy to see the visits. Next up, we have Sarah Moore. So Sarah, if you want to start sharing your screen. As I mentioned before, this is our chance to see a Power BI visualization. And I love to see other tools and folks using other tools. And Sarah is a consultant up in Indiana with a certificate in analytics from Indiana University. So go Hoosiers.
Thank you. Yeah. So this is my first challenge using Power BI, and so I've been excited to not just explore the desktop version, but what I'm showing you is what I published online. And so what the link I provided takes you to the public site right here. And then I just kind of summarize the challenge. But one thing that you can do is create an app. And so that's what I've done here and what I'm going to present from full screen. So my approach to all of this, it was really interesting and exciting to be provided data, but also branding guidelines and then mission and vision. And so I tried to take all of that in as well as what they were hoping to do with this data, which it seemed like not only analyze it, but be able to provide it to others in a way to partner in the community, gather volunteers, and put it in presentations. And so I've put this together more of a summary that can be downloaded into PowerPoint, or I'll show you in a second how you can, through Power BI, just take one visual element and just copy paste it somewhere. And so what I did with the data is I kind of segmented into these 4 areas. And then from here, you can see in patient demographics, I expounded in the analysis, and then lower below, from the different areas of conversations, appointments, and consultations, I then did a little bit of analysis here. And so I'll just start up here. My aim was to provide context and a story to not just like the topic of the data, but how it goes with their mission and vision. And it seems like conversations is such an important part to how Sunny Street operates and how they connect with their patients. And so I captured that here with their authentic conversation-based model. You will see that I have 19,000 conversations, and I've realized it's because I included the service provider conversations in that total, whereas I think others had about 16 to 17,000 total conversations. And then I went into the average appointment length, because to me, seeing that amount of minutes for an average appointment, I think correlates to probably the conversations that are being had. Also, if it's a free appointment, free healthcare, that's a long time to be able to sit down with somebody and interact about your health. And also, I think it kind of shows to the intention that these providers have in engaging with a patient. And then the total number of consultations, again, I'll show you down below where we kind of go into what type of consultations there are and how those play out over time. And then over here, patient demographics. The average age was around 42. And then as we've seen in other visuals, the highest percentage was males when it comes to gender diversity. I also captured the top cities we see most patients coming from. And that also, I think, is interesting too. To me, not being familiar with Australia, I don't know the significance of that, but I also think it provides insight when you compare it to maybe the rest of the demographics. And so I included the top 5 patient ethnicities. It was hard to fit all of them on here. And as we've seen, Australian being the highest, and then Aboriginal. And then this is just the number of conversations over time. And again, it peaked in April and May of 2020. We do see that it went down in January 2021, and then it started to rise again, and wherever we ended in April 2021. I think it would be interesting to see how the rest of 2021 plays out, especially over time. I thought that was very interesting in the midst of COVID, how the number of consultations, it just increased. Clearly there was a need that Sunny Street filled. And so if you scroll down here, I've got 2 filters, one for year and one for regional area. And so if you click on one, it will filter these data points, and a couple of them up here as well. And so what I wanted to capture here is just more insight from the data points you have up here by conversation types, patient conversations being the highest. And I do think it's really interesting, the amount of different types of conversations, especially centered around mental health, medical education is so important. And then the number of consultation types. And as we've seen, paramedic consults are the highest, allied health being in the middle, for 2020, that is. And the other thing I tried to capture here is, I think especially as Sunny Street aims to try and connect and maybe build credibility in the community, is to show the integrity of their practice and how they're trying to have good practices when it comes to taking notes and, you know, debriefs. As we can see, I think entering all doctor and nurse practitioner appointments is where we see the most divide across all the years. And then just keeping the clinic clean. And then when it comes to shift safety and patient feedback, I think that's also really important to capture, especially maybe as you are trying to get more volunteers, which I've provided a link here, but also, again, just to provide credibility and show the integrity of this practice, which I think is amazing. And so you can also filter by the regional area. When you click on a year, it does provide the ones that are available. So Brisbane, if we go here, you can see their nursing consults was at 520. It's about almost 50-50 for entering all doctor notes and appointments, but they only turned to write 18 patients. And overall, the shift safety seems to be an average of over 4.5 and above. I'm not sure how that's measured, but I think that's an important data point to show to patients and volunteers and potential partners as they seek to gain funding. Yeah, so the one thing I did want to show is that I mentioned you can download this directly to PowerPoint just by going export PowerPoint, and I already did that. But one thing I did do is kind of split this in half so that it was an easier if you just wanted to show half of it at a time. And so this is what happens when you download it to PowerPoint from Power BI. It's already in here as images. And then if you just copy paste parts of it, you can put it wherever you want. If you wanted to stick it in an email or another slide deck or whatever. That's why I just wanted to explain a little bit of why I enjoyed Power BI, because I'm learning that it has some really cool benefits when it comes to trying to take your data viz and put it into a presentation. Yeah, so this is what I have.
Well, thank you very much, Sarah. And as I've mentioned, if any of you have colleagues that use other tools, make sure they understand, because I think some people think Viz for Social Good is Tableau centric, and we're really not. We are tool agnostic, and we really enjoy seeing what the tools allow you to do things differently and think differently and analyze differently. And so I would encourage you to spread the word. If you have colleagues that use other tools, to invite them to participate with us. We love to see all of the various tools represented in the submission. So love to see those. Next, we've got Lali. So if you want to share your screen. I couldn't find her on LinkedIn, so I couldn't do my usual sleuthing to find out the background of our DataViz presenters. So please introduce yourself with your background and then show us your viz. Thanks so much for being here this morning, this evening, this afternoon, wherever you are.
Sure. Hi, everyone. I'm Lali. I'm a data visualization designer from the Philippines. I am a full-time data visualization designer, but I also do short-term consultancy work for World Bank. I've been with them since 2019, but my background is in economics. But like over the years, I just was more exposed to data analysis, and I'm also inclined in the arts or graphic design, and somehow data visualization just fell into my lap, and this is why I'm here. All right, so for the dashboard that I created, it's more of exploratory in nature, similar to the ones to the one that's done by Sarah. I wanted to give users the freedom or the flexibility to explore the data visualization and see certain data points in the data that could be of interest to them. But as I understand that a lot of the potential visitors of the website won't have much information about who Sunny Street is and what they do, I think it's also important to frame it in such a way that it tells a story, or that you have that storytelling narrative. And I think I was able to apply certain annotations to each of the charts and graphs that I did to somehow tell that story, right? So you'll notice that in both of the tabs that I created, I always started with like an overview, right? Telling users what the key figures are. I think that this is also important for key stakeholders, or for people who just wanted to see like the numbers in general, right? So we start over here with the mission, right? The total interactions, and this one includes the referrals. I included them as interactions because it's possible that there could be some interaction that took place in those formal or informal referrals, right? And then there are 4 regions with 18, total of 18 activity centers and more than 200 volunteers, including doctors. So far, these are the regions that we serve. Right, and we can see that Sunshine Coast has the bulk of patients over time, right? Now, it can be noticed that just like what everyone has mentioned, that there's a peak in the total conversations when COVID started. Then, of course, that there are these peaks and troughs throughout the years that Sunny Street is in operations. Now, it can also be noted that Sunshine Coast in Brisbane has been operating at the start in 2019 with the addition of Gold and Fraser Coast in late 2020. Okay, and here are all our Sunny Streets so far, basically all our activity centers. Now, those that are in yellow over here are the ones that fall above the average, the overall average, and they actually comprise at least 87% of the total interactions. We can also see that the total interactions in Marichy Neighborhood Center has the highest. And I believe that in the write-up that was also sent to us, it's because of the presence of more than one clinic in that area. Now over here, you can also see the change in number of interactions on a monthly basis. So these are percent changes. And also about this visualization, if you click or filter any of the activity centers, the rest of the charts and graphs will be filtered as well, right? So again, going back to that exploratory type of presentation of data, which can benefit users who might need to have this in presentations or in their reports. Now over here is the work of Sunny Street, right? So a lot of the interactions that occurred within their operations are conversations, patient conversations, and followed by education sessions, right? So, and that can be either health related or medication related. Now, third would be mental health, right? So as you can see over here, these are the breakdown of specific interaction types for every interaction, which are conversations, consultations, educations, and referrals. Now, we're quite like far from the numbers for 2020, right? But in some of the interaction types, we've kind of exceeded. Right, and also at the bottom are the our visualizations on the time that we spend with our patients, right? So these are the aggregated values. So the numbers can change depending on the activity center or region that you select, right? And overall, the shift safety is at 4.87, which I think is pretty high, right? Now, we've seen that a lot of the interactions occurred shortly after COVID, around May, and that could explain like the low average value of, or the low interaction time for that month. Towards the end of the visualization, you can actually drill down to a specific day of a month and see what actually transpired during that day, right? So for example, if I click on this specific month, right? I can see all the interactions in May, how long they occurred, and the specific notes and feedback that were logged by the clinicians. Yep, so that's it for the main tab, or for the overview. Now for the patient tab, this is for like a entirely separate data that was sent to us. Although I believe that it would have been better if there's also like patient information in the main data, the one that contains the total interaction, so that we can actually see how many of these patients are first time or are repeat patients. But anyway, for the patient tab, sorry for the delay in there. For the patient tab, it's mostly demographic information that I tried to illustrate in here. And that's like by gender, by age group, ethnicity, and by home ownership.
It appears Tableau Public is running slow this morning and having a few issues. Anytime you have a free version of software, you can expect these kind of issues when you're playing with things on Tableau Public. But it really is a nice place for us to share and see what each other is doing when you place them out there.
Yeah, let me just share my Tableau workbook instead, just so that I can show you the patient tab. Sorry about that. All right, so for the patient tab, again, we start with an overview, right? Showing the number of total number of patients since its conception, right? The youngest is at least 2 years old, and the oldest is 87 among all patients. And for those that have gender data, more than half are males and less than half are females. And as you can see, like towards this part of the visualization, for all nationalities, or rather for all ethnicities, the bulk of patients are male. And as for the age group, I've seen that most new signups are between the ages 35 to 54. And that is true across the years and for all genders, except in 2020, when the second highest number of signups is 55 to 64 age group. And as we know that most of Sunny Street patients are living in poverty, it can be noted that about 40% of them are homeless. For the Aboriginal ethnic group, though, the number of home dwellers and homeless patients are roughly the same. But in all other ethnicity groups, home dwellers exceed that of the homeless. Also, for those with ethnicity data, 72% are Australian, and Aboriginal signups are double the number of all other nationalities. Now, but we've seen like a downward trend in the number of new patients, but we've seen that there's relatively like an upward trend in the total number of interactions across the years. Currently, there's insufficient data as to why that is the case, but yeah, it could be that a lot of these patients are repeat patients, right? And that is why there's a downward trend on the number of new patients, and there's an upward trend on the number of interactions. And finally, the number of homeless patients has lessened for the first 2 years, between 2019 to 2020, but the number of home dwellers has increased for the same periods. For 2021, there's really a small number of new patients, and I can't really tell if these are just completely new patients, or patients who are like repeating customers. So that's pretty much it for my visualization. Thanks.
Very good. Thank you so much, all 5 of you, for being here and presenting your vizzes. At this time in the session, we had set it up for Q&A. I'm not sure if we had any questions come through the chat or not, Frederick, but does anyone have any questions for any of our folks about their data viz? Anything in particular you might want to ask our volunteers while we have them all here on the line today?
Kevin also noticed that Simon was on the call. I don't know if Simon is still here, or Simon from Paris. You were also selected to present, and I don't know if you maybe didn't see the email. I don't know. Do you have the urge to present in a couple of minutes when you're done? If you can, if you're still here. You here, Simon? Simon? No? All right.
One thing I did want to point out as the professor in me comes out, I love to see the branding that most of the submissions did using the white, the yellow, and the pink, which actually makes a really good color combination for those of us like myself who are totally colorblind. So a little colorblind education for you this morning, this evening, this afternoon, that for the colorblind, these 3 colors actually work really well, and we can see them, and especially when you have the white and the yellow on the pink background, and when you have the pink on the white, but the yellow on the white is probably the worst out of all of those for those of us that are colorblind to be able to see. So think about your colorblind folks when you're putting together your data viz. I don't know that you'll want to use this 3 color combination in the future for other visits, but I just thought I would point out that it works really well for me. So maybe that's why I enjoyed all the submissions this month more than others. I did also want to point out that a few of you also use this photo, which shows the 2 co-founders. So if you didn't realize that already, these are the 2 co-founders, with Simone being a nurse and Nova being a doctor. And so you've got both nursing and doctor background for the 2 founders for Sunny Street. Again, we were going to announce the top of the top, but I suppose we can do that at another time.
Kevin, sorry, in the chat before we forget, maybe. Hang on. A question for Nicole from Rohit. Can you elaborate? You arrive at the amount of $2.1 million saved. So if you can maybe explain us again, Nicole, about the cost saving, please.
Of course. So I actually, Frederick found the data and posted on the Slack channel. So there was data out there on the average cost of an ER visit to the Australian health system. I believe it was from 2013-14. And it was by hospital. So I took the average cost of an ER visit, which is around $580, and then just multiplied that by the number of conversations and consultations that happened. I didn't do it by patient because I figured, if these are repeat patients, then they're repeating that savings to the system. So I did it by the number of conversations and consultations. And then they didn't have data on exactly, if I came, I wouldn't have gone to an ER. So they estimated for the consultations for the medical that it was close to, if not 100%. And so instead of just going to that 100%, though, I decided to do 10% increments so that they can show, we don't have the exact number, but it's still huge, even if only 10%, but they actually are trending towards a higher number. Yes, and if the ER costs have gone up, then definitely the savings are even more. And so I brought that in with some research that had been published on the fact that especially these at-risk populations do tend to go to an ER more often than not because they just don't have access to a general practitioner. And so that's where they have to go.
And I think that's a big takeaway for us on the street is the cost saving or the impact on the health system. They're saving a lot of money, so I think they're proving that it's a worth organization to support as well. So that's an awesome saving. Any more questions? Kevin, do you want to add something?
I did.
All right.
I put it in the chat, but if there's time, each of the presenters did a lot of very rich views. I wondered if any or all of them had a favorite view from all the different data things. Like if you were to say, hey, from my whole dashboard, Sunny Street, if you could show people just one or two things, here are maybe the things I thought were particularly striking.
Good question.
Any of you want to answer that? Just off of mute.
That's a question for the presenters about their own visits, because they know them best.
Yes, yeah, absolutely. Do any of our volunteers want to say, here's my favorite part of my viz, the thing that I think they could really use and get the most from?
Alternately, if you
Oh, so I can start. I do think the economic impact, I've worked and consulted with nonprofits before, and funding is always something that they need, and if you can get numbers to show your impact, you're more likely to get more grants. So I think that was something I was really glad I was able to add. But then also just how the conversations, when COVID hit, they ramped up, and I think that's an important story to tell, rather than a lot of people struggled with all the restrictions and such, but they actually ramped up, and I think that was something that I really was glad to see.
Yeah, for me, besides the demographic analysis I did, I personally pretty like the final chart that I compare the locations of the patients with the location of the clinics. I think that shows their local impact, and like they should definitely expand to more locations to help more people across the whole coastline.
For me, I think for one, it would depend the end user who they're trying to share this with, but I think I would choose the top part of mine where it has the photo and the text and then a data point, because putting all that together, I think part of the intention I read was to create positive impact and show not a deficit, but where Sunny Street kind of fills in the gap. And I think having, a data point next to a photo along with an explanation of who they are could be very helpful and important.
Yeah, so for my dashboard, I think that it would be the time spent with our patients. I think that I was able to highlight in a way that our interactions over time with our patients have increased, especially post-COVID. And I think that it really goes to show that a lot of vulnerable people are needing services like those that are provided by Sunny Street.
For me, it's mainly the breakdown for the consultation and conversations, because that's pretty much what people may be interested, like how the journey of Sunny Street is over time, like how it actually increased over time and after COVID, like what the other participants have pointed out. I think, yeah, it's pretty important to see that.
All right. Are there any other good questions for our 5 volunteers? Or do any of our 5 volunteers have a question for one of the other volunteers? Anyone at all? Any question? Really beautiful work lots of analysis in there. You just had to give us the highlights. But I would encourage everyone to dig into these visualizations and take a look at them. Really beautiful work.
There's a good question on the chat. How much time did it take you to produce the data viz? How many days, how many hours?
Nicole, how many days, how many hours?
Definitely, I mean, it was spread over many days because I have to do it in the evenings. But probably 20 hours. I was learning Figma as I was doing this. So part of that was all the analyses and part of it was learning a new tool. But yeah, probably 25 hours.
Okay, Vivian, how many days did you spread it out, the work, and how many hours?
Yeah, like similar to Nicole, I also do it after my schoolwork at night. So pretty many days. Yeah, I pretty much started as soon as the project was launched and submit during the mid-September. So a couple of days, and I continually adding things and editing the visualization. So hard to count.
Many hours. Johanna?
Well, I'm pretty new to making visualization, so yeah, it takes really long time. I was struggling with the spacing in the dashboard. It keeps on changing because I keep on changing ideas. I keep on adding things. Sometimes I think this is bad, and yeah, it just keep on changing all the time.
Yeah, and again, just like to point out that our 5 volunteers who are the finalists, I don't believe any of them really work in this area. So this was new data to them, a new area. So not only did they have to get familiar with the data, they had to get familiar with what the data represents. And so I think that's really good practice for anyone to take a new data set from a new area that you don't have background in, learn about that area and test your skills. It really helps you learn and get better at your craft, I believe. Sarah, do you have any guesstimate for us? How many days, how many hours you spent developing yours?
Yeah, similar to Nicole, I actually started out Tableau and then went into Power BI, and I'm still learning Power BI more. So probably about 20 to 25 as well.
Yeah, very good, very good. Lali, any estimate number of days, number of hours you spent building yours?
Yeah, I kind of learned about the project a bit late. So I think I only started just last weekend. So yeah, I think that for the past weekend, I was just really busy working on it. Then I would just revisit it with a fresh pair of eyes, revise, edit, iterate forever. Yeah, around 3 days, I guess, 3 to 5
Yeah.
days.
3 to 5 days and many iterations, I would imagine, for each of you, perfecting it, moving it around, and really beautiful designs by all 5. Again, one of the things we miss on these types of things is you can't hear us all clapping, but we are all clapping and applauding you on a job well done. Great questions today. Enjoy the interaction. Well, I guess I'll move into our closing then. So again, what's next? We have a new structure for the board. We have a lot more folks on board looking at many different directions. But again, we're always looking for that partnership. Who else is out there that we might partner with? And so we need all of your help. We need all the volunteers out there, everyone who finds this to be a great organization as much as we do. We can't do it without the partnerships that we forge and the clients that we find and the data sets that we bring. It's all a team effort. And so I can't emphasize enough to partner with us, and let's continue to take Viz for Social Good to the next level. You can go to the website, vizforsocialgood.com. You can sign up as a volunteer. You can follow us on LinkedIn. You can follow us on Twitter. I am a huge Twitter fan, as is Frederick and several other members on the board. But if you use the hashtag Viz for Social Good when you're making your submissions and post them out there, you can go out and find many of these Vizes that are out there. I think I saw one of our new volunteers in the audience, and I would encourage you to go out and find him. I think Luke is out there, and he had a very good dark background. I love to see the dark backgrounds. We had all light backgrounds in our 5 that we presented today, but he had a really beautiful one out there that he posted on Twitter. And also I would point out that we have the Slack channel. And so if you're not a member of the Slack channel, that might be where you missed not seeing where we had added some data to the data set and gave you a new place to go and do some analysis. So please ping us, get together with us and get on the Slack channel, especially good when we have an ongoing project, and get Q&A going there. And I know that Simone was on there answering questions from the client side, and Frederick and others were on there answering some of the more technical questions and providing some more data. Do you have anything that you would like to add in closing, Frederick, my co-host and colleague and good friend from down under?
No, just as I said, maybe early, because Sonia is sick, obviously she couldn't attend, so we'll try to organize a follow-up session on probably Zoom, maybe on some Friday morning or night, wherever you are on the planet. And this time it will be more like a Q&A with Sonia and the 5 volunteers plus everyone. So I'll send an email around. Whoever wants to join can join, but hoping to have a follow-up session next couple of weeks. I hope when Sonia is better, but I think she was on email with me this tonight to tell me she was sick. She was teary. She said, I'm so sorry I can't come, but she was in pain. I think she was very bad ear issues, so she couldn't even stand up. So she had to go to bed. So she was very sorry she couldn't come tonight. So we'll be in touch. So don't worry. She was very, very impressed with the quality of the work for everyone. We only saw 5 tonight, but there were 56 really great presentations tonight. So amazing, again, great work, and I hope we can meet again. Thanks again.
And I forgot one more thing. If Chloe were here, Chloe would be reminding me if any of you who are attending, besides the 5 volunteers, want to turn on your camera and show your face for us. We would love to take a quick snapshot of the group here today. We love to add these collections of folks, use them in our announcements and showing folks out there. So again, there's Luke. Hi, Luke. How are you? Nice to see you. Look forward to future submissions. Chimde's also had a really good one out there. Fred has been constant. This is great. I love to see all of our friends and volunteers and colleagues. So wave for us, put that big smile on. Here we go for Chloe. There's my V sign, and we'll grab the recording and we'll take a snapshot there and we'll post them. And so thanks again for being with us today. And I will stop the recording and we will add this to our collection of events, and really thank each of you for being here today, especially our volunteers, especially Frederick, who's staying up late on a Friday night to organize and help this. Really appreciate seeing everyone tonight, and thank you so much.